Good morning. We're really excited to talk to you about our project today, which was quite the title, Touchscreen Technology for Health Knowledge Assessment, which we hope by the end of the presentation you'll find as interesting as we do. Before we begin, the three of us are all global development majors graduating in May, and we were united by the desire to do a domestic project, something a little closer to home since we've all had experiences abroad. And we did our project in spring and summer of 2011, and it was in Southwest Virginia, or Virginia Appalachia, which is about 6 hours away from here, but seems so much further. So just to kind of contextualize it, the area that we were in is that star right there, which is Wise County. Wise County is in Health Planning District 1, and we focused our efforts in Health Planning District 1 and 2, which are all at-risk and transitional counties in Virginia Appalachia. These areas, as you can tell from the key, sometimes have double the poverty rate of other areas in Virginia, which is astounding considering it's all one state. Partially one of the reasons that this is the case is because coal mining is the major industry there, and coal mining is so prevalent there that it puts Virginia as the 11th largest coal-producing state in the U.S., even though for many of us we don't see coal producing happening in our day-to-day. We're all from Northern Virginia, and we go to school in Charlottesville, so this area is a totally different lifestyle than we've experienced. Two of the major socioeconomic issues that we noticed through our research and through talking to our partners were the unemployment and, because of that, lack of health insurance. And when people don't have health insurance, they tend not to begin preventative care because they cannot afford that. And in this area, for some people, even the physical surroundings made it impossible for them to get to clinics or to hospitals or to doctors' offices. So, because of all of this, there are major health issues in this area. And some have said that the health issues mirror that of a developing nation in the U.S. And these health issues, as you can tell from this list, aren't things you can really ignore. These aren't colds and coughs and snivelly noses. These are heart disease and cancers and diabetes. These are all life-threatening. So we saw an opportunity to address maybe these issues, and to do so, we just didn't really know where to begin. And what we soon realized is that we could begin right here at UVA because we have a Healthy Appalachia office at the medical center. It's led by David Cattell-Gordon, and it really focuses on telemedicine. That's kind of the specialty of this office in bringing health access to this area. David Cattell-Gordon is from Virginia Appalachia, and that's why he's so passionate about it. And he was a huge asset because he was able to set us up with community partners and a visit to UVA at Wise, which you know we have a sister school in Wise County, Virginia. UVA at Wise, and actually looks just like UVA. It's kind of like a little mini UVA, except for in the mountains of Appalachia. When we were there, we met with Health Wagon. Health Wagon is a mobile clinic in Virginia Appalachia, and it's led by 2 nurse practitioners who actually travel to patients, bringing them free services, which is incredible considering that they're able to do that and in that area. And those 2 women who lead Health Wagon are instrumental in putting on remote area medical clinic each year. And this is a 3-day clinic, and it's set up on fairgrounds in Wise County, and it sees over 5,000 patients in 3 days, offering completely free medical, dental, vision services. And interestingly, UVA is one of the huge contributor of volunteers to this event. We send over 200 doctors and nurses every year. So we had that relationship between UVA and between all these partners somewhat established. And after speaking to all of them, we were able to narrow our project focus on 2 diseases that they thought maybe we could impact.
The 2 diseases our partners wanted us to focus on were heart disease and diabetes. As you can tell from the maps here, the darker regions are where things are basically the worst. So obviously on this blue map over here, the darkest regions are where there's the greatest percentage of adults with diabetes, and over here is where heart mortality is highest. Continuing on. So in creating a health education program, we wanted to do a few things. The first thing that we wanted to do was that when we talked to our partners about presenting heart disease and diabetes as issues, our partners weren't really able to tell us what exactly their patients didn't know. So our first goal was to identify what those patients didn't know. Our second goal was to actually present the health education program in a place where there's a captive audience. And then finally, we wanted to make sure that we were able to quickly update the program and ensure that we provided something that was sustainable. So our solution to the problem was actually to create touchscreen tablets with a health education tutorial and quiz.
And we actually have the tablets today for you guys to kind of get a visual of what they looked like.
The tablets were programmed using an e-learning program called Adobe Captivate, and the content was determined by our community partners. There are 8 to 10 quiz questions, and just to give you a quick idea of what our quiz was like, instead of telling you about the quiz, we'll go ahead and we'll show you a couple of questions. So for instance, if you were to answer this question incorrectly as a patient, if you were to answer true, which I'm not sure the clicker will do, it would actually go on to the next slide, which is showing why the answer was incorrect and providing the correct answer. This allowed us to both collect information and to provide health education.
So to give a brief recap of how things went, in March 2011 we had the visit with UVA-WISE where we kind of determined the focus on diabetes and heart disease. And then that was also where we selected the remote area medical clinic as a testing ground for the tablets. And then in July we went to the clinic and spent 2.5 or 3 days kind of passing out the tablets to different patients and trying to see what they thought of them and collect data. And then in the fall of 2011, after we had collected all our results, we brought them back and tried to analyze them and see how to move forward. So from our experience at RAM, or the Remote Area Medical Clinic, we had a few takeaway points. Probably the most encouraging one was the positive patient reception of the tablets. Each quiz has 2 final questions which ask, did you learn something? And did you find this quiz helpful? And over about 90% of patients said yes to both those questions. We ended up collecting data from 113 patients. And from this data, we were able to identify a couple knowledge gaps or questions that were frequently missed by patients. You can go to the next one. This was an example of one of them. People said, what disease kills the most women each year? Most people said breast cancer, where it's only 46% said heart disease. And it's kind of overwhelmingly heart disease kills the most women every year. Can you go back? Yeah. But also from this experience, we were really able to see what these tablets could do. We kind of thought of them as something that you could put in a waiting room and they would just sit there and people could come in and while they were waiting to see their doctor, like kind of scroll through them. But they really did a great job kind of starting a dialogue between us and the patients, and they would want to talk to us about how they knew certain questions or the ones they missed and kind of find out more information about those questions. And then we could kind of refer them to the patient educator or give them some literature on those subjects. So though it went well, we did run into a few obstacles. Probably the biggest one was technical difficulties, getting the tablets to work well. They're relatively new when these came out. I think it was only a month or 2 on the market. And we had a little trouble with the quiz freezing up, or one of the tablets would power off randomly, so we kind of had to follow it around and restart it. Also, the touchscreen is kind of relatively new. A lot of people don't have much experience with it. So we'd also have to be there, make sure people could select and move through the quiz. Some people had issues with that. And then we spent a lot of our time making sure that our questions were helpful and informative and relevant, and also not too obvious, maybe didn't contain any controversial medical information that people are disagreeing about nowadays. So we spent a lot of time trying to make sure that our questions would actually be useful to Healthy Appalachia and Health Wagon. But even with all these obstacles, we tried to make the most of our time. So even though these things would kind of eat into it, we would, when we could, we'd talk to different doctors, nurses, or patients and just get as much feedback as possible and see what they thought and how we could improve our product.
So that brings us to where we are today, and we are actually really lucky. A group of students has taken our project and is kind of doing that middle step before we would implement it on a bigger scale. And what they're doing is they're going to take tablets and see if that's really the most effective way to educate patients. So before we make that huge investment, these things are cheap, compared to traditional forms of patient education, just to make sure it's really worth it and it really is making a difference. And that project will take place this summer and next fall. So we don't have those results yet, but really showing how sustainable the project is and all the places it can go. And then the thing we're most proud of, our biggest takeaway, is we think this is a really neat and exciting way to educate patients who otherwise might not be getting this attention. And the best part about it is, it's really, we can really take this into other arenas. we can put it into the private sector as a possibility. We also can tackle other diseases, other issues. They're reprogrammable. We really see a lot of potential with this idea, both here and abroad. So thank you. And we look forward to answering any questions.